Every Thursday, we're taking a look at a health issue or concern affecting many people, breaking down the information for you and telling you what you need to know to keep you healthy. Dr. Kalani Brady from the John A. Burns School of Medicine joins us now with this week's topic, and it's something that many of us are familiar with. We're talking about dementia. I think almost everyone knows someone who has dementia or has a family member, friend dealing with dementia. So first of all, how do you define dementia?
Dementia is a progressive loss of thinking that includes language development, judgment, and memory. It's progressive over time, and it begins to affect your activities of daily life.
Okay, and is there a difference between dementia and Alzheimer's?
There are many different kinds of dementia. Not enough time to address it in this short period of time. However, Alzheimer's is the most common form of dementia. And Christine, include Lewy body dementia, multi-infarct dementia, but they all are treated similarly. There are some specific treatments that are done, including with multi-infarct dementia, good blood pressure control to prevent further strokes.
So Alzheimer's is a form of dementia.
The most common
form. Okay, and what are some of the risk factors for dementia?
Oh, there are a lot of risk factors. They include a low educational attainment, midlife high blood pressure, which increases the risk of dementia by 50%, midlife obesity, hearing loss, late life depression, diabetes, which doubles the risk of dementia, physical inactivity, smoking, social isolation, and of course the big one, increasing age.
Okay, and that leads me to my next question. At what age does dementia usually develop?
After 60, the incidence of dementia begins to double every 10 years. So by 75, 80% of all dementia cases have it.
But I was talking to you earlier, and you say that people as young as 40 have been diagnosed with dementia. So it's not something that only our kupuna are diagnosed with.
Correct. It can happen in very young people, but it's pretty uncommon. A half to two-thirds of all patients in nursing homes have dementia. That's, if you look at the number of nursing homes, that's a lot of people. And by age 90, it affects 50% of all people. And if you have a family member that has dementia, it doubles your risk of getting dementia.
Okay, so it can run in the family?
It runs in the family.
And how is dementia diagnosed then?
First of all, you convince the patient to go to the doctor. Secondly, you make sure that the doctor is spending extra time on that visit with that patient, because there are memory tests which the doctor will perform, which are basically the hallmark of the diagnosis of dementia. In addition to that, the doctor will make sure that the patient doesn't have depression, which is commonly masks as dementia in its presentation. And blood tests include a vitamin B12 level and thyroid function tests to make sure the patient isn't hypothyroid. In addition to that, in almost all cases, a CAT scan of the brain is done.
And if you are diagnosed with dementia, what are some of the treatments available?
Well, there are medications, but it's important with medications to know that they don't reverse the dementia. Unfortunately, they only slow the progression of dementia, and they include donepezil, which is known as Aricept, Exelon, which is rivastigmine, and memantine, which is Namenda, and they slow dementia. Usually they're given for a 6 to 8 week course in the beginning to find out if they're all successful. And then there are family things that can be done. Limiting driving, obviously, with a demented patient is important. Limiting cooking so they don't burn or cause a fire is important. Avoiding falls is also important.
Now, I know a lot of people watching might be taking care of a parent, grandparent, or another relative or friend who has dementia. Any other advice for caregivers?
Oh, yes. Caregiving is the gold standard for treatment of dementia. And as you say, we in Hawaii, we frequently take the demented patient in and make them part of our family, although nursing homes are full of dementia patients.
Okay.
First of all, in order to be a good caregiver, you need a busload of patience. When a demented patient starts arguing with you and they're wrong, change the subject rather than continue the argument. Frequently, the patient will remember that there was something wrong with the relationship. If there's an argument, they won't remember why. In addition to that, writing lists is important so that activities and telephone numbers, which are important, are on the wall of the dementia patient in their bedroom. Because of sundowning, which means increased confusion at night, a nightlight in the bedroom is very helpful. Okay. Fall prevention, speaking slowly to the patient, encouraging activity, and very important, respite care, because it's easy to burn out taking care of the demented patient, and so you want to have a plan in place where someone else is helping you take care of your patient.
All right. Well, thank you so much, Dr. Brady. You'll be back next week, and our topic for next week?
Weight loss diets.
Oh, I'm glad you're going to be talking about that. Something that I need to stay on top of as well. Well, thank you so much. And thank you to the caregivers out there, because we know that dementia is very common again, and it takes a lot of work and patience.
And patience.
To help
yes.
out. All right. Thanks, Dr. Brady.
Thank you.